I am here to demonstrate the sonographic features of normal fetal brain structures. So if you are watching my video for the first time on YouTube, kindly subscribe, share and like. So let's quickly go back to the business of today. As you can see here, you see this is a normal fetal brain. If you want to measure the BPD, for you to measure the BPD, you must get the thalami. You can see this point. I want to point like this. This is the thalami. You can see this is the thalami. So if you want to measure from the outer to the inner. Just watch the way I'm measuring it from the outer to the inner. It will give you the BPD. So right now it's giving us 35 weeks, 5 days. So after that, you measure the HC, which means head circumference. You can watch the cursor as I'm moving it. You move it, you put the line straight at the level of the thalami. Once again, you move your cursor or your caliper. You can see it, how it is being measured. So let's see, this is 36 weeks, 5 days. So now we are going to look into the anatomical structures of this fetal baby. You can see here, let's look at the choroid plexus. See the echogenic area here that you are seeing. See, this is the first choroid plexus, the lateral choroid plexus. That shows that the baby is very, very okay. Then if you move away closer to this choroid plexus, this anechoic area here, this place I'm pointing this caliper, it is called the lateral ventricle. The lateral ventricle, you can see it here. You can see it here, there, over there as well. So it's normal. Then from there, you see the vermis. Can you see? Can you see this vermis here? This, echogenic line snake-like. Okay, it's called a vermis. It shows that it's normal. We move on to check the cerebrum. The cerebrum. Let's move. Let's move. Let's move. Okay. Here we go again. You see the cerebrum here. You can see the caliper pointing at it. The cerebrum here. You see the fornix. This is the fornix, dividing the both cerebral hemisphere. It shows that the baby is, doing well. From the hemisphere closer to the posterior fossa, you see a very, minor anechoic region here. Let's see, which is known as cistern magna. Okay, sorry, madam. Cistern magna. Cistern magna is within this area here, closer to the cranial vault. This cranial vault you are seeing here. So this area is called cistern magna. Sometimes the fluid within this cistern magna can be high. And if it is high, it means that things are not too okay here. So when you measure it and it's over 10 mm, it is called megacisternal magna. Megacisternal magna. So let's move. After we have checked the vermis, the cerebrum, the thalami, then we move to the anterior horn of the baby. You can see it here. Let's move to the anterior horn. This is the anterior horn. One of it is here, another one is there. That is the anterior horn. Then I want us to look at this anechoic area here. This area that this caliper is pointing at, it is known as CSP, cavum septum pellucidum. Cavum septum pellucidum. It is a very good indicator that the baby is fine. So the choroid plexus of this, produces the cerebral fluid. So it's very, very okay that you understand the anatomical structure. Then you look at the cranial vault. Everything is complete here, as you can see it. Look at it. Everything is absolutely fine. Then there is another anechoic brighter echogenic area within this thalami, and it is called the cerebral falls. So everything within this baby is very, very okay. So if you have learned something useful from this video, try and drop your comments on what you have learned from it and what you're supposed to learn that you didn't see, so that we can do more better in our next video. Thank you so much.